Good afternoon, everybody. You know what? Big strides in innovation are made through the collaboration of exponential thinkers. I'm James Duez, CEO of Rainbird, and I'm joined here by my good friend and partner, Ahmer from Rolanto. Thanks to Daniel for giving us an opportunity to share what's new in the area of human-centric AI, and also how these technologies can be deployed to create lasting change. Now, at Rainbird, we've spent the last decade thinking about thinking, how human experts reason and make complex decisions. We captured the tribal knowledge of the engineers who mastered the albums that the Beatles made in order that that could be captured in software, so a new generation of engineers are able to ask questions of those solutions and retain some of that knowledge and continue to produce that sort of sound. The same technology was used to capture the knowledge of a man called Chuck Barker, who helped negotiate the release of Nelson Mandela, so that when he retired, we could turn him into an app and enable other people to be able to make collaborative negotiation work in similar situations. Now, when I hear about all these amazing innovations that there are, and I ask people how they do it, they tend to answer, well, I used AI. And for me, that's like asking, what did you have for lunch? And you telling me you had food, right? It's not helpful, and it's one of the reasons why AI has something of a PR problem. Not all AI is equal. Machine learning is AI, but not all AI is machine learning. Now, as Alfred Whitehead said on Monday, he made the point that ChatGPT and a lot of these solutions are making predictions, and they are not necessarily the same as judgment. We rely on humans to make judgments over these predictions. And machine learning technologies, which we see lots of, they're amazing, and they're presenting us with some amazing opportunities, but also some challenges. And one of those challenges is what we call the black box problem. Now, we are in an era where machine learning and generative AI are the zeitgeist, and we would like to put a spotlight on the resurgence of something called symbolic AI. Now, symbolic AI starts with humans, not just data. Now, what you see here is an example of a prior auth model. This involves capturing knowledge from skilled experts as a map, and then connecting that map to data. And when queried, this simulates higher-level critical reasoning, and it outperforms the expert that builds the model. It's being used to automate complex, highly situational decisions faster and with quality, consistency, and very importantly, trust baked in. Now, this differs from machine learning solutions for a few reasons. Number one, it's democratized. So this enables experts to build their own systems. And it's trustworthy because this can explain the rationale behind every decision. It's making judgments, not just predictions. Now, these technologies appeared to have a lot of promise in the 1980s and 1990s. The 1990s was the last time AI was interesting, right? You've heard a lot about this AI winter where this technology retreated to academia. And although some of them still exist today, they failed to have lasting impact because it was hard for experts to be close to the process of encoding knowledge. You didn't just need to be an expert, you needed to be a mathematician, a philosopher, a linguist. And there was limited access to data over which this knowledge could then be applied. So what's changed? Well, the data problem has changed. We're awash with data, and models can now be built with no code. That process has been democratized. And with access to tools like ChatGPT, this is only getting easier. Gen AI can act as a co-pilot. It's very good at understanding an expert's knowledge, and it can actually transform that into a model that's not black box at all, but glass box. Because explainability breeds trust, and trust is required to breed adoption. Now, I'm going to provide some healthcare examples in a moment, but this has already transformed some of the largest organizations in the world, enabling them to scale scarce and valuable human knowledge. It's central to the digitization of Deloitte's UK tax practice, where it's powering a range of new tax tools, so Deloitte partners can provide a more human service. Imagine that, a more human service through the adoption of AI. And it's making them leaders. They've stated that they now aspire to be the leaders in the digitization of tax and people. At Ernst & Young, they built their first ever global SaaS solution based on this principle. They allowed 18 months to build this. They built it in 6. They shaved a year off the development time, and it reduces a process that takes months down to 15 minutes. And this is something that machine learning could never do. And they do all this without their experts losing control. They actually underwrite the high-value advice. They put their logo on it because it is explainable. Now, analysts like Gartner have produced some independent case studies in this area, and if you're interested, I'll be happy to share some of those with you. But this one Gartner slide shows their view that beyond robotic process automation, which is used for trying to automate some of these processes and machine learning, this methodology represents a vast, untapped field of opportunity. Now, a couple of very quick healthcare studies. During the first wave of COVID, the UK NHS was under enormous strain. 1 in 4 staff were either off sick, isolating, or were actually confused as to when they were allowed to go back into work. The NHS mandated that they needed to protect the most vulnerable, and so they wanted a risk assessment that was able to take into account people's ethnicity, sex, age, and their entire medical history. There are 2 million employees in the NHS. Now, there were no humans to do this work, because there weren't enough occupational health consultants around. There's no product to buy off the shelf. There's no data to base a predictive model on. And if you did build a predictive model, it would make just that, a prediction. It wouldn't make an evidence-based judgment. So we built this solution in three two-hour sessions with a leading clinical safety expert within the NHS. It took 2 days to test and 5 days to get through a clinical approval process. So what was an idea was turned into something that was real and deployed in 8 days. And this was updated, in some cases, every hour with new evidence, and it could cope and adapt to that change. 1/3 of the people in the UK have musculoskeletal problems, and the vast majority of them don't have any access to physiotherapy because of cost or because of a shortage of resources. We worked with a national provider and captured the expertise of physiotherapists and created a solution that automatically designs patient-specific hydrotherapy programs at massive scale, explains why they're the right program, and then adapts. And every week, thousands of patients get quality hydrotherapy really cheaply for the price of a swim in their local pool. So in the US, we're already working with companies like Gamewell, the largest payment processor for Medicare. The initial focus is on tackling the administration of healthcare, a $265 billion problem. The first project is prior authorization, but we're also working on provider enrollment, complex claims, and others. And as a platform, you know, when the gentlemen from Deloitte were talking about how we need platforms in the future, this is about finding opportunities to co-create solutions by making this platform available to as many people as possible. And that's in the nature of this great collaborative conference. Now, there are loads of great point solutions out there designed to solve very narrow, specific problems, but we need these platforms. We need ecosystems that enable, in this case, experts to co-create trusted AI tools and leverage their own expertise as well as data and make that explainable. Again, explainability delivers trust, and that's how we get these solutions adopted, leveraging our best people working in symbiosis. So symbolic AI is back, and it fills a big gap that very few people are addressing. It can be applied to all problems that are constrained by a shortage of skilled human capital and brain power. It's a trusted AI co-pilot that, unlike some other tools, like GPT, which is fantastic, isn't just making predictions, but it's rendering evidence-based judgments at scale. Now, this technology is great, but it's really not enough on its own. And as Shauna said, right, technology creates what's possible, policy dictates what's permissible, but I would add to that, it's people that decide what actually is operable and can be deployed. And with that, I'm going to hand over to Ahmer, who's going to talk a little bit about how amazing technology can be, but you need an empathic and human-centric approach to change to be able to get stuff done.
Thank you, James. And as James talked about, symbolic AI is what is required in understanding the human reasoning. Time and again, when we talk about the biggest hurdle in driving AI-based digital transformation in administrative processes, one of the questions comes up is data. If we start with the data, that gap will always be there because human reasoning and judgment requires a lot more than data. It requires experience and expertise and wisdom. And to capture that wisdom, we have to take an empathic approach to understanding how people think and how they decide and then make a judgment. So with that, quickly, like pervasive acceptance of the benefits of AI. We all know this. And yet, when it comes to the enterprises, the news is not so great. 90% of the AI initiatives fail adoption. And we're talking about the administrative side of the things. Less than 3% implementation of administrative AI. That is a abysmal number. And 50% of chief data officers fail within the first year of these high-profile jobs. Why is that happening? And how do we basically turn the tides around? So for that, we have to lead with a sense of empathy. And why is that? Because research after research is showing that driving adoption is not a technology problem as such. It's a human problem. It's about trust, context, reliability, culture. All of those factors are human factors. So we have to bring the sense of empathic design and human-centric design into AI solutioning. So with that, quickly acknowledging that change is hard. Ignaz Semmelweis, even with evidence-based recommendation, requesting doctors to just wash their hands before delivering babies, and he couldn't convince them. A simple task of just washing hands to save the lives of newborn. It was that hard back then, and it still continues to be a simple act of wearing a mask to prevent pandemic. Same thing, right? So we have to understand about the truth versus perspective, because when we share facts around something, we have to put ourselves into the shoes of the individual who is receiving this information, because truth and understanding of the truth depends on the perspectives. So when we think about the perspectives, it gives rise to this opportunity about the potential of AI. It has to be rooted in the empathy for the people who run it and the people that it serves. And it has to be that ecosystem working together. So with that, we designed this framework called Mindful AI, which is leading with the awareness and purposefulness of the intentions and emotions that augments human potential. So that means that we're transforming from a typical task-oriented based approach, which is why do we do a task? And a typical approach is let's map out each and every individual task and figure out a way to augment and automate it. We take a purpose-driven approach, which is not just what we do, but why do we do what we do? A simple example here, we work with a healthcare system, and we partnered with about 20 nurses who are making decisions on reducing the likelihood of hospital readmission. And when we looked at what kind of information they were using, limited sets of information, but the judgment was driven by a lot of their own expertise and experience, a lot of tribal knowledge. So when you talk about it's so difficult to change and transform the administrative services, it's because so much of that is locked in tribal knowledge and wisdom. And automating that with any system is not that easy. So in their case, we mapped out all of their semantic decision-making processes and normalized it across to figure out the commonalities and the differences and why those differences were important in bringing some sort of an automation and improvement into this entire process. So that's why it's coming together, right? So empathic-based approach. Within that, when we're designing this solution, we have to ensure that we're designing it not just for feasibility and viability, but it's designed for lovability. And I wanted to introduce this whole concept of lovability because our expectations for our digital experiences are informed by the best-in-class experiences. Then why are we making really, for lack of better word, shitty experiences for the people who are making decisions, life-changing decisions for our patients and members? So we have to take that framework because we want to make sure that they love and find a delight in using these applications because that's augmenting their intelligence. That means co-creation, partnering with them, working with them, starting at a micro level, telling an impact story of the impact and scaling it at macro level, and picking the right problems to solve, which is the critical element to this. So when we take this approach and lead with that, what we are finding is that it's not just that we're solving problems in specific administrative processes, but we are starting to see that it's paving the pathways for cross-collaboration across organization. And in the case of the hospital readmission, in that case, the clinical services started to collaborate and work more and more closely with financial planning and analysis and risk management, because all is an ecosystem problem. Before that, they were working in silos. So taking this semantic approach allows us to create that cross-collaborative approaches and framework. And we strongly believe that there's so much tremendous innovation that's happening in clinical and diagnostics AI. And we have heard about it. Biggest hurdle continues to be administration. And unless we tackle the administration problem head on, we will continue to see the failure rate being so high. And we are fortunate that by taking this approach, our success rate so far has been near 100% wherever we have approached this. With that.
Yeah, thank you. So I think, look, just to wrap up, thinking about now, near, and next, ultimately what we're tackling right now is we're trying to transform the healthcare administration process and get some of that cost back. What's near? I tell you what was near 4 hours ago when I wrote these slides was to make generative AI explainable so we can deliver trust and accountability. Not just get a prediction of an answer back, but use generative AI to create models that are glass box and are open to scrutiny. The reason why I say that is in the 4 hours that's happened, we've already done the near. As far as the next is concerned, this is about opening an ecosystem up so that everybody is able to take this expertise, this platform, and turn themselves into a superhero capable of changing the world by blowing up and exploding their own expertise. Thank you very much.
Thank you, guys.
Thank you.
Quick question. So we're bringing down to your next. What do you guys need from the NextMed Health community to help you realize all this?
So this is a great collaboration, right? So the world needs more platforms, ecosystems to go and build amazing tools. We know that this can be applied to an almost infinite number of clinical use cases. So we just want people to come and take the technology, play with it, discover it, learn its capability, and find great things that we can go and do together.
All right, let's do it. Thanks, guys.
Thank you.